Elastomeric respirators are used by American healthcare systems. It's just that most systems don't use them exclusively. They have solved supply chain crises in the past, such as during the 2009 H1N1 influenza crisis. The most common ones include 3M's 6000 series half face mask or the 3M 7000 series full face masks. Full face masks may be ideal as they offer eye protection, but due to limited supply, half face mask respirators are a reasonable substitution as long as you cover them with a shield and your eye protection. Both require an inspiratory and expiratory valve leak check. And again, you can find numerous examples of performing a leak check online. After securing the mask to your face, you cover the expiratory valve and should not be able to blow out. And then you push against the cartridges or cover the cartridge holes and try to inhale, creating a tighter seal around your face. Both require a surgical mask over their expiratory valve for use in most surgical ORs. I feel this can be done by placing a surgical mask around the expiratory valve and securing with a rubber band. So both the 6,000 and 7,000 series 3M face masks require filters or cartridges, and each type has its advantages and disadvantages. The 2000 series filters are the disc kind. They are particulate filters, and difficulty breathing through them indicates that they need changing or they have reached their limit of use. I do not have any of my own for personal use, however, because they consist of a filtering. They are encased by a filtering fibrous material, and I am not sure of the best way to clean that other than you could treat it as an N95 disposable filtering face piece respirator and drop it into a Tupperware container and then hang it up as it dries. I guess you could also cover the filter with a surgical mask to protect it from droplet spray. The cartridges offer the advantage that they are more easily wiped down and cleanable. The 7093 particulate filter cartridge is liquid gold right now. They are the easiest to clean, and they consist of the same filter material as the discs and are rated P100. The expiry date is on the top of the cartridge. The 6000 series cartridges are organic vapor and gas cartridges. They're your pink ones. They have the ability to filter different gas and vapors along with P95 or P100 filtering capability. Those cartridges may not become more difficult to breathe through when their filtering capacity is worn out, and from what I've read, continuous use of any cartridge should not exceed 30 hours. Or if they become difficult to breathe through. The manufacturing date on the 6000 series is going to be shown right here. I think the most important things to note about your elastomeric respirators is that when used in the OR, they do require surgical mask or surgical drape coverage, and they require meticulous cleaning and disinfection. Improper handling and cleaning after use has resulted in virus transmission. For anyone with a non-disposable elastomeric respirator, I strongly suggest you read your package insert and have a plan to disinfect the surface after use and then clean at home. Clorox cleaning wipe or hydrogen peroxide wipe or solution should function as an appropriate disinfection immediately after use. You must have a place to lay the face mask on and then apply a surgical mask. This needs to be done after every use. Particular attention needs to be placed at the point of contact with the skin, and that is why I do not recommend the use of our purple cleaning wipes, the Cavi wipes, because those are caustic to the skin. When you take your face mask home, remove the cartridges and, according to the package insert on your respirator, take the mask apart and immerse it in either a 5,000 parts per million Clorox cleaning solution or a hydrogen peroxide solution, followed by cleaning with soap and water to remove residue, followed by a rinse and drying, which takes about 6 hours. I suggest using 3 different baskets in a basement. This concludes my presentation.